So today we have a patient that is requiring more than 6 liters of oxygen to maintain an SpO2 greater than 89%. So what we need to do is escalate to the next step. So right here I have the high flow system. This is available on 2 south, 7 south, and 4 south compounds. If you don't have this on your floor, you have to 50-50 for it. We ideally would like you to call your respiratory therapist before applying this. However, if you have the means and have the supplies readily available, please put this on your patient and then immediately call respiratory therapy to let them know you've escalated to the next oxygen delivery system. So, this right here is the high flow canister. So you're gonna open this up and you can see that it's empty on the inside and it requires humidification. So, in your middle equipment rooms, you should have this bottle, and this is our humidification water. Make sure that you're checking this bottle. There's similar bottles that have different colored caps that say 0.9 or other substances in them. You always want the one that says humidification or for inhalation only. So you're gonna open this up and you're gonna fill to the maximum line. You'll notice that in the bottle, there's still gonna be about half left. Twist, date, and leave it in your patient's room. They could reuse it. You're gonna put the top back on. And it's just gonna twist. There you go. And then your high flow nasal cannula tubing is gonna look different from your traditional nasal cannula. You're gonna see that it's gonna have this large bore green tubing. If it doesn't have this green tubing, it's not a high flow cannula. You're gonna attach. And I'm just gonna let my patient know I'm gonna take them off of their oxygen for just a moment. I'm gonna take off the current delivery system. I'm going to attach my high flow. And this is gonna go from 6 liters per minute up to 15. Good, and same thing, when you look at this, just like you do with your nasal cannula, check the back of the ears and those nasal passages for skin breakdown. You may have to put ear coverings on your high flow device to protect your patient. Gonna place those into the nasal passages. And make sure to tell your patients there is gonna be that high flow pressure. So they might feel a little moist, they might feel some nasal dripping, and that's normal. Tighten it again so it's comfortable and not too tight, but stable enough that it stays on your patient. And now since I placed my high flow, I would call my respiratory therapist and let them know so they can come and assess the patient and make sure that we don't need to do anything else.